I've had the wonderful experience really of working with children with a range of different neurological disorders and with their families. And I've been so impressed with the resilience and the strength at which these families and kids have had to confront extraordinarily challenging and frightening neurological situations. At the same time, I've become really concerned and actually really shocked to see how little we know about the psychiatric aspects of neurological conditions. And in my work with doing psychiatric evaluations of children with epilepsy and multiple sclerosis, what has really come across to me is that these children have higher rates of anxiety and depression, and that all of it isn't necessarily due to the natural experience of being traumatized by being in a hospital, that there even are probably some underlying brain factors that might lead children that have these kinds of conditions to be more prone to have symptoms of anxiety and depression. So we know in adult MS, multiple sclerosis, for example, there are higher rates of depression. And although it hasn't been studied in children, the more and more that we see of kids with these kinds of conditions, realize that there's so much that's unknown and that so little attention is being paid to their emotional state. And this is partially understandable because we have parents that are so overwhelmed with dealing with the medical problems that it's easy to say, well, I've just got so much to deal with now. I'm so worried about my child's epilepsy or my child's multiple sclerosis. How can I deal with yet another thing? But in fact, it could have a great deal of impact on how a child takes their medication, on whether they are compliant with treatment, how much they're suffering, so that I'm really very interested in this and have been studying this for the last few years and have become a part of an MS team and work with children with epilepsy, and have found it so important to identify to pediatricians and neurologists that these kids also have psychiatric problems.